Good evening and welcome. Thank you so much for everyone being here this evening. My name is Carrie Hulett. I am the interim dean of the School of Graduate Studies, and I'd like to welcome you to our third in our series of the 25th anniversary of graduate programs here at Elmhurst University. This is our speaker series to highlight our various graduate programs here on campus, and so this is our first one of the new year though. So welcome to everybody. Thank you for being here. Thank you to our panelists for being on the panel. I'd like to introduce you to two individuals, and then I'm going to allow the other individuals to introduce themselves. The first person I'd like to introduce you to is Becky Hulett. She is an associate professor here at Elmhurst University, and she's currently the program director for our MSN and DNP programs here at Elmhurst. The second person I'd like to introduce you to is Laura Minarich. Laura is an assistant professor here at Elmhurst University and is the program director for our MENP program. And I will allow the other panelists to introduce themselves. And Becky and Laura, if you'd like to say anything more, but thank you so much for everyone being here tonight, and we look forward to a wonderful evening to discuss our topic. So thank you.
Right. As Carrie said, I am Dr. Becky Hulett. I've been a nurse for 29 years. I'm a certified CNL. My clinical background is in transplant and nephrology. I've been teaching for over 10 years now, and I've had 8 years here at Elmhurst University. And Dr. Minarich?
I am Dr. Laura Minarich. I have been a nurse for about 14 years. My clinical background is in bone marrow transplant and more recently in family practice. I am also a clinical nurse leader, but again, more recently in family practice. I'm a family nurse practitioner and currently working as a family nurse practitioner. I've been at Elmhurst for about 5 years. I am going to hand the floor over to our panelists. I am going to have them introduce themselves. I'm going to start with Amanda down here, and then they will work their way down. So if Amanda can introduce herself and get us started this evening. Thank you.
Yep. Hi, my name is Amanda. I have been a nurse for going on about 4 years now. I graduated from Elmhurst University in 2020, and I currently work at Elmhurst Hospital. I work in their cancer center. Specifically, I work in their infusion area, administering different infusions such as chemotherapy, immunotherapies, IV antibiotics, and iron infusions.
My name's Lindsay. I have been a nurse coming up on 5 years this summer. I currently work at a fertility clinic, but I also have background in adult general medicine and the pediatric ICU.
My name is Alex. I will be a nurse for 4 years this year. I have background working as a rehabilitation nurse at the Shirley Ryan Ability Lab, and I currently am working at the University of Chicago in their adult and their pediatric ED.
Hello, I'm Nancy. I've been a nurse for about 10 years now. Primarily my background is in women's health with inpatient labor and delivery, and currently I'm in the outpatient ambulatory setting with women's health and OB-GYN, and I am the nurse manager there.
Hello, my name is Michael. I will be a nurse for 2 years this summer. I work in general pediatrics at Advocate Children's, and I am a graduate of the BSN program here at Elmhurst University back in 2022.
Hi, my name is Yolanda Rivera. I've been a nurse for just over 10 years now. I started in adults, moved over to pediatrics, and I'm currently a nursing professional development specialist, a fancy word for educator, at our Almost Home Kids locations in Chicago and Naperville, which is an affiliate of Lurie Children's.
All right, thank you, everybody. I am going to start us off for our discussion tonight. If some of you could give us an example of your most complex patient, what made it complex, and how did you help that patient navigate the complexity of their care?
I think I could start with that one. Recalling my experience just working with adults, I did work in adult surgical heart unit. I worked with patients who were on ECMO, CRRT, ventilators all together. That's a lot of life-sustaining support. One of my most complex patients had all of the three, and they additionally had over 10 drips. And I wish I could say that I was coordinating the care directly with them, but them being sedated and comatose almost. Most of the coordination of care came with the families. And I think that was one of the hardest experiences I had coming from a step-down unit where I was used to maybe one of those three things, and now I had all three things working against this patient, and having a family who came from another country who didn't understand the complexity of the care. And I think one of the biggest tools that helped me was consistent, genuine communication, having them understand bits and pieces and not overwhelming them with all of the information that was surrounding. And a lot of times they found themselves wanting to get the gist of everything that was going on, but I also could see them not being able to fully captivate half of what I was saying. So just giving them time to like pace that information and just spend that additional time that is sometimes needed. And it's so hard to do when you're working in an ICU, but if you give yourself just a little bit of coordination with like the prioritization of the patient needs and just acknowledging that there's extra labor that goes into the communication piece, I think that's really what helped them kind of understand what was going on, get through the challenges of the process of their loved one, and have a general appreciation for the department that I was working in at that time.
I think I can go next a little bit off of that. So I think reiterating the communication point, I also had a patient who communication was a difficulty with the family due to a language barrier as well as a developmental barrier with the parent. And so the complexity of care, that being multiple diagnoses for the patient during the one hospital stay, as well as being on a general unit where there was one nurse with 3 other patients on top of trying to ensure that the family is understanding everything that's going into the diagnosis and everything that's going to their treatment plan. I think communication was just so important and took time. So the complexity of care in this case, I think, was evident with the time that needed to be spent translating and then ensuring that family was fully on board and understanding of what was going into the patient's care.
And I can further discuss an event with a 26-week pregnant mother who came in to a community hospital with limited resources, that was severely anemic, but came in hemorrhaging, abrupting, and there were staffing issues along with staffing shortages, but along with experience on the floor. This patient needed resources, and having not being registered within the care network that the hospital was associated with, there was no information known about the patient. It was during the prime time of COVID, so later on we found out once this patient delivered that she was COVID positive, so arranging communication with her partner who wasn't able to be with her while everything was going on, and then not knowing the status, and also her infant having to be transferred to another higher level of a higher level of care. It was important for, again, the communication aspect to make sure that the patient herself recovered and was able to make it through what went on with her, and then also knowing the status of her child.
Oh, I can go. So in my time at the Shirley Ryan Ability Lab, we cared for patients with locked-in syndrome, which is a very rare type of stroke that causes paralysis below the level of the eyes, but the patient is completely cognitively aware. So they can only communicate typically with looking up, down, or blinks. So during COVID, I was caring for a patient who had this. He was a young father, and his family lived out of state. So he could not communicate. And as he progressed in his recovery, he was capped with a trach, and speech was still just kind of a difficult thing for him. And he was separated from his family because it was COVID. So he was just very much, I think, in a lonely space, and people didn't understand him and what he needed. And so I think taking the time to sit with him, I would sit next to him and just be like, try again, slow down, let's do this. And trying to take the extra time to make sure that he was being heard and he was being understood meant a lot to him. And, you know, other nurses would come to me and ask, like, can you help me to understand what he needs? Can you do this? And it's just a matter of, you know, people can be very complex and they can have difficulties, but I think the main thing is communication for them, making sure they are heard And I mean, I actually became very close with this patient. I got to follow up and see him progress after he was discharged from Shirley Ryan. So it was really special for me that I was able to provide that. But in the beginning, it was just being human and being understanding of the fact that, you know, we're in a very scary time in our world, and it's even scarier to be, you know, locked inside your body and not have that ability to fight for yourself. So, yeah, I think communication is just such a important part of what we do, and not just like actively listening, not just hearing what they're saying. So.
Thank you. I think a lot of us are probably really moved by a lot of the complexities of some of what you have all shared, and definitely communication. I'm going to push you a little bit more and see if any of you can share some more stories or some more examples of how you've seen nurses influence patient care, and maybe some of the stories or experiences you've seen there of what nurses have been able to do at the bedside, or other experiences you've had.
Yeah, I can start with this one. So yeah, I think at the forefront, you know, a lot of times nurses, you know, you think of nurses as that like first patient advocate. So kind of that bridge sometimes between, you know, the patients and the advanced providers. And, you know, a lot of the time you think of that physical care that nurses are providing to patients, but there's so much more that nurses can provide, you know, spiritually, mentally, emotionally. It makes me think of, at my very first job, I worked on a medical surgical unit, and I was working night shift, and I was taking care of this elderly woman who recently just got a terminal cardiac diagnosis, so she had about a year prognosis. And I fortunately was able to kind of check on her that night, and you know, I asked her, is there anything, you know, outside of the, you know, physical care that I'm providing that I can do for you? And she was like, if you have, you know, 20 minutes, I would love to just sit and talk with you. And I ended up sitting in her room for almost an hour, and she, you know, showed me pictures of her children. She kind of told me her life story, how her and her husband met. So it's like those little moments where you can really take a step back and see like nurses have so much influence on someone's care, just not the physical, you know, daily tasks that you're providing. And after having several family members in the hospital, you know, one in particular told me that, you know, you could have thousands of patients, but most of your patients at one point in your life will never forget you being their nurse.
Definitely. And going off of that, you know, I think generally speaking, you know, when I worked on an inpatient unit, nurses are there at the bedside with that patient for 12 plus hours a day, and they really get to know their patients, their baseline vital signs, trends in their lab values, and they're very often the ones calling those rapid responses at any change in status, deterioration of their condition. And you know, it just goes to show you the value of nurse assessment, head-to-toe assessments, really tracking those trends, and getting that patient immediate intervention, transferring them to a higher level of care. They're just truly the eyes that the patient need. I also think more specifically beyond a patient's physical well-being of caring for a patient with significant psychosocial, emotional, cultural factors involved in her care. She was admitted for abdominal pain, needing emergent surgery. She was very distressed, and upon an admission assessment, it was essentially revealed that she had many factors involved in her care, and she had just moved to the United States from a different country, so culturally she had challenges. We had to involve the language line services to help break that language barrier. She also expressed that she didn't have any family, you know, in the States with her. She had given birth 2 weeks prior to being admitted, and now this infant that she described to us was under the care of somebody that she described solely as her partner, not necessarily as a lover or a husband, and she was concerned for her infant's safety. So there was a lot involved, and, you know, as the nurse doing this admission assessment, I had to look past, you know, her physical condition and truly try to understand how it could help her emotionally. So It was a multidisciplinary approach to her care, getting her connected to a lactation consultant. She was breastfeeding, but still navigating that. She was connected to social worker. She also was connected to outside resources through the church and food pantry. And eventually she was connected to a domestic abuse resource, and that escalated. And so it just goes to show that nurses really care for patients beyond their physical well-being, and that it's really important to do an assessment on a patient to see where you can help care for them beyond their physical bodies.
To continue on, to touch base on that, I had a patient who, it was her first pregnancy. She was shy of imaging that, was shy of a day of imaging to be repeated. And just going through her history, we connected in a way. We shared experiences, life experiences of our mothers, and we connected in a way. And one thing for me that highlighted our experience was that she said her mother always told her, make sure you always connect with your nurse, because your nurse is the one that spends the most time with you, and take in consideration what they say and advocate. And as we continued, she gave me some more history, and then we were able to get the imaging done for her, and then we were able to opt out of induction and go with a C-section. And she ended up delivering a 10-plus pound infant, and she ended up hemorrhaging. And then with our time together and then with assessment, we were able to put in place things to make sure that she was safe. So we had interventions placed, that she had a successful delivery and recovery. And patients are always vulnerable when they're coming to seek care. There's also that mistrust factor, just given all the information that they're surrounded by, hearing from hearsay or from technology. And just having that time with patients and being able to express how the nursing experience goes beyond just that physical portion, but goes on with emotional support, but also with experiencing critical thinking over the years, you learn patience, you learn patterns, and you're able to pick on things that might not be obvious and maybe subtle. So nursing definitely is a profession that a lot goes into it and goes for the patients, and as well for our own well-being as well, to have that gratification and that solitude that we're making a difference and we're helping patients that may not always have that experience.
All right. Thank you very much. It's very evident. It makes me very proud to be a nurse, to hear you guys, hear your stories and the way that you've influenced patients. So let's kind of pivot here. Let's talk about health literacy. Okay. So how can patients expand their own health literacy, and what advice do you have for patients and or families that might be consulting Dr. Google?
I can start. So working in the ED, I experience a lot of Dr. Google diagnoses. People come in thinking that, Google said I'm dying or something extremely wrong is happening, and it's, really nothing. And I also work in an area that just is, they're low socioeconomic status. There's a lack of health literacy in general in the area, and there's just a lot of lack of access as well to healthy food. There's no primary care or urgent care. It's just us here in the ER that take care of them. They have very limited access to primary care physicians as well. So I think part of it falls on us when we do see them, like me in the ED, others on the floor, to just try our best to give them the resources to educate them on either the disease that they have, if they have anything, educate them on their medications, educate them on whatever we can, and just try to give them the correct type of resources to go to when they do leave our care, just because Dr. Google is very unreliable. Yes, and I caution whenever a patient comes in and says, I Googled it. I'm like, well, why did you do that? You can just come to us and we can tell you what's going on. So, I tell people as soon as they tell me that, don't do it again. We can help you. We can give you better answers to these questions than Dr. Google can.
Yeah, and I think going off that too, it's also important to applaud patients, for actually taking the time to do their research because, there's definitely some of, patients who, they go to an appointment and, all the information kind of goes in one ear out the other. So definitely I think it's good to, even if your patient comes up to you and says, I found this from Google, applauding them for doing their research, but then kind of pivoting them toward other, resources. And I like to just encourage my patients to just reach out to us. My transition to the clinic is different than the hospital because we do have a patient portal. So patients definitely are able to communicate with us easier than, if they were in the hospital sometimes. So I always encourage them to reach out and, just tell them no question is a stupid question. We would rather have you be as informed as possible. And I think, too, with health literacy, just keeping in mind and not assuming that everyone has the same means to learn. So someone might prefer, watching a ton of educational videos, and then others might prefer to have a handout to kind of read it on their own time. So I think, too, just starting that conversation with patients, too, and kind of seeing where, their comfortability is with learning that information.
And just going off of that, I think as nurses and many clinicians would agree, we want to empower our patients to take charge of their health care. And despite the challenges with Dr. Google, there are really many advantages to it. And so I think it's a great opportunity to ask open-ended questions to patients. I love to ask, have you researched your symptoms and your condition? And if so, what have you found? And it really encourages a good discussion. And it also just shows opportunities where they might need to be educated about how to locate those resources if they are at home, looking for web links that end in .gov, .org. But also it's just a great opportunity to educate the patient and just redirect them, debunk false information, because, it's something that also has many advantages, but I think we just have to educate.
And then just to add to all the great comments, I'm trying to sit back and even just reflect on my experiences. And I've been a nurse for 10 years, and in the 10 years that I've done this, I've seen a lot of changes, and that's a very small amount of time in nursing, and to say you're a professional in nursing, just given all the changes in technology and the patient needs in the community that we're seeing. I look back and I remember teaching at the bedside for discharges and just giving a handout and hoping for the best. And really that was the best that you could do as a new grad sometimes. You're like, okay, I'm just trying to get my stuff done. But as I got more experience and I saw these people coming back, I started seeing that a trend that, education is a huge component of population well-being. And we're seeing this shift in healthcare, and you saw it through the pandemic, where we're pushing our patients to be advocates for themselves, to not be in the hospital if possible, and to get a little bit better at scrutinizing, do I need to be here versus do I not? And a lot of that came through direct education from nursing support. A lot of times I did see, those barriers to health literacy. Where I currently work, our profession and our specialty is patient education. And one of the first things we do is we assess. We say, what kind of learner are you? Do you like pamphlets? Do you like videos? Do you like to write notes down? Assessing that situation. And that's one of the things that we constantly empower the population to kind of see, people in the community to see, to self-reflect, identify what they can learn best by, and being that advocate for themselves, speaking for themselves, say, hey, I'm not this kind of a learner, or hey, can you repeat that back? And in healthcare, we are so burdened with a lot of work right now that we as nurses have to kind of take a step back and say, we can't look rushed. We have to assess if the learning is taking place, and just take those 2 extra seconds to really see if they're processing that information, or identify maybe another route for them to obtain that literature or literature piece or learning piece. I used to do community health education, and I did a lot of health fairs, so I'm a huge advocate for them. I think a lot of people in the community see them, they see the pamphlets, but they don't know if it's for them or if it's not. And I think one of the things that we can always do is identify what those free resources are, because they're going to be the best route for correct information or evidence-based information. And I think when it comes to Dr. Google, I see it in my family a lot, where even just yesterday, my nephew was born, and my mom was saying something about colicky babies, and she's like looking it up, and my brother goes, "There goes Doctora Google," and I found myself laughing, but at the same time, kind of like saying, okay, we have to use a little bit of caution with everything that we Google. We can't nix everything, but maybe we could start helping, people in the community identify what those good resources are versus what's not, and then still just encouraging that verification through a healthcare provider.
All right, I have a follow-up question to that. So when you guys need information, where do you go?
That's a great question.
I usually go, I have done a lot of research at the Cleveland Clinic and Mayo Clinic's website. If I don't know something about a disease or its treatment options, I've found that those websites honestly have a lot of information. Cleveland Clinics and Mayo Clinics are both like at a reading level that are typically, they're a little bit higher education, not like, they're probably high school level education, but it's enough that I can, at least get a better understanding of something that I don't know and then be able to relay it to somebody else, so.
Yeah, I would agree. I use Cleveland Clinic a lot, and I like their site because it also lists other various like trusted sites at the bottom of their sources too. So that just provides like other options to go to, in the future to use.
Also, a common one is the cdc.gov. Yes. Pretty common. So that one's another good one to use. I reference it as well. And again, it has resources and sources within that link or within that site that are to trusted other sites. So.
And I will say one of the things that we've kind of just seen, even within our graduate studies, is that there are many resources that are reputable, but a lot of times the literature is just not very common literature for people who are not in healthcare. And I think one of the biggest eye-opening experiences for us in our graduate studies has been identifying those, resources that have the learning tools that anybody who even isn't in healthcare can understand, benefit, and take home with them. And I think that that's one of the biggest benefits that we've had in this program, is just learning, just for our future knowledge, something that we could share with other people in the community and our peers themselves.
Also, as nurses, many of us have resources at our jobs. So our whatever respective facilities or institutions that we work for, we can access information there that is usually trusted as well and verified. So that's just another one to add.
Thank you. I am going to move us along with the next question. And I'm going to ask you about current challenges that you're facing in healthcare in your current jobs.
I think a big one that in lieu of COVID kind of highlighted for nursing is burnout. We've come from a generation where we take on, and really haven't set boundaries. And we promote for patients to have a work-life balance, or promote patients to be able to find that balance and taking care of their mental health and whatnot. However, us nursing, sometimes we forget that to do that for ourselves. And I think with leadership, there's a shift and a change that's needed to set those boundaries, accept them, and realize that this is a change in culture. And to not forget that we are humans ourselves and that we need that to balance.
I think going off of the burnout route here, is the education and level of experience that are seen among the staff. We're seeing so many new nurses. I myself am relatively new, novice, as many refer to it, and we are seeing on my unit, as an example, there are more and more new grads that are coming in. So just making sure that we are properly training, educating, and giving those new nurses the experiences that they need to care and safely care for patients is proving to be a challenge, but it is doable with the right people and resources.
Kind of going completely off topic, but this just became prevalent when I made the transition to my clinic, because I think in the hospital I was never exposed to kind of think about this, but while working at a fertility clinic, especially, within the last year and the Supreme Court decisions about Roe v. Wade, it really has opened my eyes to just access to healthcare and kind of expanding on that, just like how insurance also plays a really big part in that. So a lot of my job, deals with a lot of couples struggling with infertility. But a huge kind of gap that I've seen is, for example, same-sex female couples don't meet the diagnosis of infertility as of right now. So a lot of insurance companies will not cover any of their care. But if you think about it, there's an aspect of their fertility care, utilizing a sperm donor, for example, that they would need to go to a clinic for. And insurance companies just look at the textbook definition of, infertility is struggles between a man and a female. So I think just highlighting that whole opportunity for access to patient care and, how we can start to make changes to be more inclusive of, those types of couples, and, that can translate to all areas of nursing. I think there's a lot of gaps, which as, society progresses, we need to kind of take a step back and see what changes we can make.
Yeah, in that same vein, I work in a, low socioeconomic area with a lot of social determinants of health that play into patients' care. And so there's no primary care access for patients. They have to wait months to get in. That's for the adults and for pediatricians as well. It's about a 3-month wait for a pediatrician. And if your kid's sick, you want to get them seen. And there's no urgent cares, there's no immediate cares in the area. And Medicaid only covers one of the two. They don't cover both immediate and urgent care. So families, if they are on Medicaid, have to be cognizant of where they are bringing their family members, because insurance may or may not cover it. So often I see patients that bring their child in for a fever or strep throat or hand, foot, and mouth, something that's so basic that a pediatrician could get you in and out in a half hour for, that families are waiting hours and hours in the ER for, because, we have to prioritize our very sick children. And coming off the winter months, it's been RSV that has been taking over our pediatric ERs and even into our adult ERs. And people with minor colds, strep, things like that have to wait, at least in the adult side, they can wait up to 10 hours just to be seen. So getting access to people who need it and providing the right resources for people in the areas that they're most needed is something that I had never really looked into. I always had access where I grew up. I was very fortunate to have that. And so working in the area that I do, it just has opened my eyes to how many gaps there are in our healthcare system and how many ways that we need to do better.
I think also a challenge we're seeing in nursing today too is workplace environment, how nursing leaders manage conflict, workplace violence. I think it speaks to nursing education. Some of us up here are on that educator tract, and it just challenges us to think differently about traditional ways of education. Last week we were able to engage in virtual reality learning and really immerse ourselves in an experience and be face-to-face with a patient, trying to, resolve conflict and de-escalate situations. And we are, in fact, seeing an influx of new nurses in the field. And how do we better prepare them for these situations that will arise? And so I think that is something that we can definitely improve upon, and fortunate to be, in this program working towards that degree to pursue education and hopefully be a part of that shift.
And to add on to Amanda's point, also shift to support nursing when they're going through experiences of workplace violence amongst other staff or even patients. I think technology now, we have a security issue where, employees, healthcare workers aren't protected the same way as patients. A lot of times we don't have a choice as to where our picture gets posted, or if there are restraints that a nurse can be going through with a partner, or if they have a protective order against, whatever's going on in their life, there's no protection for nursing on those aspects, or even mental health support for having patients in hospice, or having an event, a tragic event with a patient, or building that relationship and losing a patient. I think we need to recognize that nursing also needs that, as well as patients.
And I think just to add on the technology piece, I think we're moving so fast with technology, and nursing is, at a race to keep up. We're constantly learning of new systems that are being implemented to improve security with patient information and to improve processes. And sometimes they're not, clearly ironed out. And part of nursing is trying to keep up with that technology so that they can work with it, implement it, and be successful, but also not lose that critical thinking piece, because we can't be at the mercy of the technology 100%. We still have to use our critical thinking, because there are laws that will hold us accountable for the care that we provide at the end of the day. So it's a fine balance, and I think it's one of the challenges that I see more and more. Younger generations are adapting a little bit sooner to it. Some of us are not. But I think that requires a lot of just self-motivation, a lot of self-advocacy as a nurse, and stating I need more training, I need more support, and then just finding and utilizing your resources, which sometimes can be scarce. And I think that's what the challenge really is.
I have a follow-up question to that, and I would love for all of you to answer this question. What do you do to take care of yourselves? Nancy mentioned burnout, and we've been talking about the complexity of the healthcare environment. What do all of you do to take care of yourselves?
Oh, I can start. I craft. I actually make badge reels for nurses. And I also read a lot. I read 54 books last year. Yeah, it keeps me sane. It's one of those things where it's a mind break from everything. So that's what I do.
I would say for me, I love working out. So especially after, hard shifts, I think working out helps me to, decompress. My mom is also a nurse, so I know sometimes, it can be hard to continue to talk about work, but definitely certain situations, it is nice to just talk to someone that understands and has gone through something similar. So definitely being able to talk to her or even other friends who are nurses too, I think helps a lot too.
I really enjoy being around my family. They're a great support system. And so I think quality family time is really important to me. It helps me just recharge and just have healthy discussions about work, but also just as reminders to be grateful for a lot of the things in my life. I'm involved in my church. I get to sing at church, and I have a community there, as my faith is important to me. And I love dogs, so sometimes I get to go volunteer and spend some time with some dogs, and yeah.
For me, for self-care, massages are always on the top of my list. Taking time to take care of myself, so I get my nails done, as you guys can see. But family support, music is my biggest therapy, and journaling.
As an individual activity, I enjoy walking my dog and nature walks in general, whether it's cold, hot out, doesn't matter. And then as a group activity, I enjoy singing in a choir here on the university, actually. So,
I'm very family oriented, so I find myself finding a lot of comfort in consistently meeting with my family. It's a big distraction to me, usually from the day-to-days. They're not in healthcare, none of them are. So when they ask questions, I'm like, no questions. But I really find myself just feeling just refreshed, touching base with them, realizing that there's more outside of a clock in and clock out. Sometimes when you move into these positions, I'm currently in a salary position that's a Monday to Friday, I feel like I don't detach as much, but when I'm with my family, I close the chapter on that part of my life and reopen it next week. And it really just helps kind of recenter myself. And I also enjoy going to family dinners with friends. So we have dinner nights once a week at least. It's a lot of money, but it's worth it.
All right, thank you, everybody. Okay, so our last question tonight, if you could tell the general public one thing, or maybe two, about nursing or healthcare, what would that be?
I'll start. We'll start on this end. One thing about nursing is there's definitely a change happening in nursing, and I think we can take it in a good way or a bad way, and I want to focus on the positive of which way we're taking it, where we're moving in the way of more autonomy in nursing, of more responsibility, but an opportunity there, an opportunity to really be the advocates for the patient population through communication and education and support. And I think right now we're just at a pinnacle of where we can take it in, like I said, a good path or a bad path. And what I like to focus on, especially bringing on a lot of new graduates into our department, is really supporting and boosting and creating the culture that we want to develop in nursing. So I think we're right at the start of something great, and I think that if we all kind of like work together collaboratively, we can take it in the right direction.
I want to keep it simple and say nurses are human, just like the humans that we care for. So the one thing I want the population to remember is that we care for them, and I hope that they care back for us, and we try our best in our different capacities, different specialties, different jobs that we do. We try our best to make sure that they are their best. So
Nursing is the backbone to the care team, and with leadership, we need a shift to support not only nursing but patients, and I think we will get there. We're at a prime time that we have the general public involved, and we have nursing leadership shifting, that now together I think we can make the change that's needed.
To put it simply, we are doing our best. We are coming off of a very unprecedented time in our world, and it put healthcare workers through the ringer more than anybody else, I feel like. And, we're all just trying. We're trying to do the job the best we can, but we are human again, and we have struggled with you, and, let's be more together in this world as we move forward off of this pandemic, have a better understanding of each other so that we can all, try and take care of each other the best that we can.
Yeah, and I think, coming off the pandemic and definitely, how involved social media is, it is hard to sometimes see how, nursing kind of has gotten that negative light and, kind of only showcasing kind of the struggles. Any career path, has their struggles and kind of areas for improvement, but nursing truly is such a rewarding job, and despite everything that, I've gone through and all of us have kind of gone through over the past couple years, like, I can confidently say that I would never pick a different career path to do, and I'm very grateful to be able to, consistently, take care of others and support them.
Going off of that, and to go back to what we had discussed earlier, some concepts relating to burnout and being overworked, I just hope that nurses still have a passion for the profession and are glad to be a part of it. I think there's been a negative connotation of the field, and though we've been through a lot, I just think what also sets nursing apart is that it is such a compassionate profession that all those who are in it should truly be grateful that they're a part of it. It was explained to me long ago, I think it was in high school, that nursing it essentially bridges the gap between science and compassion. And I think those things together make all the difference rather than separate. And that truly is what I think nurses do in their day-to-day jobs.
Thank you. No, unless there's any questions from anyone.
I just want to say thank you to our panelists tonight. You guys are all phenomenal nurses, and that definitely came out tonight. So thank you for sharing your stories, and thank you for being nurses and graduates, soon to be graduates of our MSN program. I'm very proud of all of you. So thank you for being here, and thank you for watching.